Hello everyone, this video is a continuation of previous video on pulpal pain and pulp tests. So let's begin. These are the most common doubts on pulp test, so we will take them one by one. Number 1. How long we have to wait after trauma to test for tooth vitality? So the answer is 4 to 6 weeks. Why? Because it is a time required for the nerve fibers to repair or regenerate. Number 2. Which test to use for immature and traumatized tooth? Well, remember, for immature tooth, the plexus of Fresco are not well developed, so neither the thermal test nor the electric pulp test will give any response. Whereas for the traumatized tooth, we know we have to wait for 4 to 6 weeks to get any response. Next is, what is the location of thermal and electric pulp test? So for heat and cold test, we apply the source on the mid-buccal region because the enamel is thinner in this region. So you must be thinking, why don't we apply it in the cervical region since the enamel is thinnest in the cervical region? It is because if we apply it in the cervical region, it may damage the soft tissue or the gum. Whereas for the electric pulp test, we apply the agent or the electric pulp tester on the incisor region for the anterior teeth and on the mid-buccal region for the posterior teeth because the A delta fibers are most predominant in these regions. I hope it is clear. So the next is, what is the duration of heat and cold test? For heat, duration is less than 5 seconds. For cold, it is less than 15 seconds. Because if we apply it for more than this duration, we may damage the pulp. So next is, which test to be used for crown? Remember, whether the crown is all ceramic, all metal or PFM, we have to apply the electric pulp tester directly onto the tooth. So we have two options for crown. Number 1, either place the micro electric pulp tester directly below the cervical place the electric pulp tester, micro electric pulp tester cervical to the crown margin, or we can use the bridge method which is shown in the figure where the probe is placed cervical to the crown margin and pulp tester is placed on the probe. Okay, so now the important things to know for electric pulp test. Number 1, electric pulp test in patients with cardiac pacemaker is contraindicated because it causes arrhythmia. Number 2, patients with extensive pulpal calcification will give false negative result for electric pulp test. Number 3, patients who have hyperthyroidism, they have hypercalcemia, and we know calcium block the sodium channel and thus we require twice the current. So we have to keep these things in mind for electric pulp test. I hope it is clear to you guys, and if you like this video, please subscribe my channel and hit the bell icon. Thank you.